Hi everyone, Dr. Nemechek here for another week in review. Before we start, I'd appreciate it if you could hit that subscribe button so we can build up our viewers. This increases us in the algorithm, so makes it easier for other parents and patients alike to be able to find our material. So first we got is 9-year-old male. Started the protocol about 4 years ago. Autism, some speech, not much. Unique thing here, drenching night sweats, and then frequent tantrums. Have been started on fish oil, olive oil, and inulin. Increased awareness, comprehension, language is starting to improve, and the night sweats are almost completely gone. Now, drenching night sweats, where you have to change the shirt or the linens or something like that, very unusual. It's often related to a bacterial overload, and from you'll see it in some populations. They might have tuberculosis, or here you might have valley fever, kind of a slow growing infection, but also overgrowth of intestinal bacteria can do this, all right? And so the inulin helps lower that, but it's not completely gone. He plateaus, the night sweats worsen, so now with that history, I'm thinking the inulin quit working, so they come and see me. We put him on monthly rifaximin, and this seemed to help, but then we just kicked it up to continuous because the night sweats weren't going away. And once we did the twice daily continuous rifaximin, night sweats just completely stopped. And what that tells me is we've balanced the gut more fully and kind of maximized the ability to lower inflammation with the rifaximin. Begins improving again. We then added, so around this time I'm learning more about the glutamine, so it's about a year ago, so we added in the glutamine. He had some bloating that dramatically improved after the glutamine. That doesn't always happen like that, but it did. And then since that point, kind of rapid improvements in math, reading, and socialization are improving. And so at this point, the parents decide he's on rifaximin, fish oil, olive oil, and the parents decided to continue the glutamine. Which is fine to do if you want to. Reading, writing, math, near peer level, speaks well at home, speaks really well at school, but very hesitant to speak at home. And this is a common little thing you'll see where, the home language is less than language. It's more grunting and gesturing, and the kids are just tired from speaking all day at school. So that'll get better though. He now will set the table every night, helps to wash the dishes, so he's getting involved there. Had 2 loose teeth, stimming kind of bumped up with that, and once those come out, he'll be fine, and the parents want to just continue on the glutamine starting the school year. Next is a 12-year-old boy. So he started this less than a year ago, or a little more than a year ago, I take it back, on March 24th. He had been on inulin, fish oil, olive oil, and they were kind of on and off and on and off, and the parents didn't see any, they'd been on the inulin at times for a couple months and they didn't see anything, so they just told me you had no awakening or anything there. So, and then things worsened a lot in the spring of 2024, and that's when they came and saw me. And he was also having this chronic abdominal pain. So I put him on continuous rifaximin, fish oil, olive oil. He's having a lot of constipation. So I said, get him on Miralax every day. We gave him 6 weeks of glutamine. And within a few weeks, anxiety, hyperactivity, aggression starts dropping. And this chronic abdominal pain, which he had for years, just stops completely. Gets COVID back in January 2024. Now he's still on the glutamine at this point, and worsening anxiety and aggression. Mom adds the VNS, the Vitality Smart Cable, that helps calm him down. At the same time, the neurologist is trying some risperidone and Vyvanse. Just everything's worse with those drugs. They get rid of that. So he's now on continuous rifaximin, fish oil, olive oil, and glutamine, continuing to improve, less anxiety, aggression, has a great summer, and then suddenly constipation worsens, and he's more aggressive, And this happened right after they had the first 2 weeks of school were really good. And then the mom was worried about they were using like little candies for ABA, and the mom was worried about giving him that, so she told him to stop. He basically has an emotional meltdown over these candies. I think he felt betrayed or bullied or something, that they wouldn't give him the candy whenever he was performing correctly. Maybe he had an emotional concussion or something. Yes, they say, can't be in school, go back home. And so the aggression was relapsing, but just within 2 weeks of being at home, he's starting to calm down. I've told Mom, get the Miralax back to every day, because he was pooping like 2 or 3 times a day, and he had calmed way down just with that. And I said, when he goes back to school, let him have the candies, and I think we'll be fine. We don't go and change the whole protocol. What you should do is look at the problems that arise and try to solve those problems, and usually the protocol underneath is still working, is how I approach this. Not everything works out as you plan. 11-year-old kid starts the protocol back in April. Now the parents have been using the protocol on and off some. So we start inulin, fish oil, and olive oil to see what happens. Here he's got just prompted one-word speech, can follow some commands, tantrums, very hyperactive, can only get one bite in at dinner time before he has to get up and run around. So inulin, fish oil, olive oil, plus the glutamine to cover for COVID damage, nothing in 6 months. So we just switched him up to, instead of inulin, we put him on continuous rifaximin, fish oil, and olive oil, and we'll just see. I think there's a very good chance he'll respond to that, but we'll have to see in a few months from now when we follow up with him again. And finally, 10-year-old girl. So she started this on the protocol just this year in January. Autism, nonverbal, tantrums, hyperactive, and from socialization will only interact with her mom and dad. It won't interact with siblings or anybody else. We start fish oil, olive oil, inulin, very quick, more aware, more responsive, so she has the awakening. No improvement in language or hyperactivity at all. So she got this initial bump, but nothing after it. So, and she was losing some teeth in there, which, as we talked about before, can trigger some aggression while the teeth are loose and coming out. So we threw in a 6-week course of glutamine in case she had some secondary leaky gut from COVID damage as well. And with that, it was like magic. The hyperactivity and aggression start to really come down. Socialization, she's now readily wanting to play with her siblings and things like that. And her speech, she was completely nonverbal. And even though she's not speaking at this point, lots of babbling. Lots of effort at like mimicking speech, like, when you have a sentence, the cadence of a sentence, she would be like blah 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 blah, trying to talk. So she's trying to mimic the parents, and I think that bodes well for her to start to develop those pathways and speak in the near future. So that's all for this week. Some good things. Some kids who didn't recover. Multiple kids improving with glutamine. This COVID issue is a big deal. Big deal. And I'm now just routinely starting kids on the glutamine when I start them here as a new patient. So you may want to add a 6-week course of glutamine in your regimen. That's all for today. Everybody, take care of your kids, take care of yourself, keep your inflammation down. Until next week, this is Dr. Nemechek.